Hello.
Hello.
Why, hello there.
Well, hi. Did
Hello.
Shayna tell you why I'm late?
I told him you were making a patty.
No, I don't eat meat. I was shoving a veggie chicken patty. Literally, I'm glad. Yeah, I should have showed you. It was kind of entertaining, but it's in there and I'm now able to function. Hi. It's been a day. How about you guys?
I'd completely agree.
Oh my God. Is it just
It's
me?
been a day, a weekend, every day
It's been like a
craziness.
life, right?
Mm.
Oh my God. Went to the pharmacy right now to pick up. I don't know. Did I tell you guys I have cyclic vomiting disorder?
No.
So this is a teaching moment. That's why I'm bringing it up while we kind of wait for everybody. Well, almost everyone's here. So cyclic vomiting disorder is kind of like being pregnant, but you're not, and you have morning sickness. And it sucks because no one likes to throw up. And it was to the fact I was probably throwing up about 16, 17 times a day. And I got it maybe like 5 years ago. And it kept going undiagnosed. Oh, it's this, it's that, whatever. But what happens is apparently when you're like, obviously I'm very excited and I'm so like hyper, but whenever you have a very exaggerated mood, so if I'm really, really happy or really, really laughing or really, really upset, I throw up. And so they prescribe Zofran. Are you guys familiar with Zofran?
Yeah.
Oh, I just heard a baby say yeah. Did a baby just say yeah?
Yeah, my baby.
Oh, good. Yes, good job. So Zofran is actually, I don't know if you guys know this, it is not now recommended for those who are pregnant. So of course I have to go to the pharmacy every time. They always look down on my stomach and I'm like, I'm not pregnant. Not that I'm saying I look pregnant, but I'm like, I'm not pregnant. Like it's for something else. So it's actually considered, I guess, a psychiatric, and I'm okay to say that. It's like kind of like an ADHD thing mixed in with it. So that's something else now you guys know. So there are people that will literally throw up when they get excited. I literally had a guy twerk at my rehab and it was so funny. I was laughing so hard because he didn't know what the hell he was doing, which made it even better. As I was pulling up and he started twerking and I vomited everywhere. And so, however, okay, so the whole moral of the story is I was at the pharmacy forever because my psychiatrist did not call it in and I had to wait. So I'm here and I'm happy to be here. And you guys probably don't know this, but this is our last class. I don't know if I told you that.
No, you didn't.
Only, okay. Well,
Nope.
Let me tell you why. So first and foremost, I'm recording this just because I know some people may not be here and I want them to at least get the information because I went off of, so we're playing Jeopardy again. We did Quizlet last week, but I incorporated a lot of what people said they wanted to go over and review. And yes, I know I'm a hot freaking mess right now. Sorry. I'm like, bah. But you guys have finals in 2 weeks. So I felt like, okay, I just felt like giving you this time. I mean, I'm happy if you guys want to come on next week. You're already in my calendar. I mean, I'm happy to do it. It was more for you, not for me. So that you have more time to study for your finals and finals week. Hell no, I'm not doing it. I mean, you guys deserve that time to study, and 1 hour is 1 hour. Hey, let's take 1 hour, right? So
Yeah.
oh, sorry, there's a baby. Sorry, I cursed. So even with my the third semester, so their last class will be next week, not yesterday, because they didn't have class, because they don't have class the first of the month because they only need 3 a month. So unless you, but I did want to say this one important thing. If you want to talk, have any sort of like counseling session, any sort of dialogue between just anything about classes, about how you're feeling, anything like that, then we could do that maybe the next 2 weeks instead of having actual class, so that you can take this time, kind of put it to the side. Not that I mean, I love it. This is honestly, don't tell anyone. I have, out of my 12 classes, I have 3, and this is one of my favorites. So just because everyone's so, they participate, you guys are into it, you actually want to learn, like it's amazing. So I appreciate that very much. So thank you. So let me know how you feel about that. You can contact, I mean, everyone has my phone number, right? I mean, I've given it out like 800 times, and I've gotten some texts from people if they need something. So today, what I thought we would do kind of as like our final, if you will, is like I said, I looked through the homework when I said, oh, what are you interested in learning? And I took some of those. I am a huge person on reinforcement. If you remember nothing from this class, please remember reinforcement. Going over and over things. So for example, let's say I'm learning about antidepressants. I am going to go over and over them. And as an instructor, I do that with my kids, if you will. And they say, like, Miss Amanda, like, oh my God, like I remember them. I'm like, yeah, because you went over them. And then we stack on top of that. And then you go over it and you go over it. And then you remember, because that's how your brain works. It goes, what is your memory center? What's called? It starts with an H.
Hippocampus.
Excellent. Cat. I don't have to look at your name. I know who you are now. I know your face. Cat. Exactly. Your hippocampus. So your hippocampus is going to hold that memory, and then hopefully your amygdala will feel the memory and actually remember where you were when you remembered it. So that's why they say, like, when you chew gum, or like me, I do when I'm teaching psych, I actually do hand movements because it helps people remember. They'll imagine me in their brain doing the hand motions that I do, like wellness or psychosis and all this stuff. And they actually do better. They told me at Mission that students have done better since I've done that. So kind of keep that in mind when you're studying. I just wanted to throw that out there since, wait, oh good, your first semester. I'll see you again. Okay, I was about to have a heart attack. Okay, so hopefully we're gonna be together. I'm hoping that I'll get to do maybe one theory class. That's my hope. And or third semester success class. But I want to, do something with you guys if that's possible. We shall see. Does anyone have Dr. Casmar's number? Because it like, I don't know if she blocked me or I'm not getting through, but does anyone have it? No?
No.
Really? I'll call Sonia. She'll have it. She's my girl. She'll give it to me. Okay. Okay, so I'm going to pause real quick. Does anyone? All right, so there we go. All right, so what I did was I looked over what people had put that they wanted to learn, and then I did some reiterations. Hold on, I just need to find the Jeopardy. Where did you go? It was there and now it's not. Come on, Blue, where are you? I might just have to pull it back up. File, new window. Oh, I have it on my thing. Perfect. Sorry. I don't know where I pressed it and then it went away. So I don't know why. Jeopardy. So some of these I pulled from, so I know what you guys did this morning with SB. So I pulled a couple of them just for fun. As again, reiteration, because if I haven't said it before, on your NCLEX, reiteration and remediation of your questions are the most important part of you passing per NCLEX. So success class, that's you guys, right? 226. We're not going to play against each other. We are a team. Let's be a banana. Yeah, let's be a banana. Potassium, right? No foot cramps for us. Can you guys see the screen? No?
You're sharing, but I don't see
Not
anything.
yet.
Okay, it's okay. Everyone's gonna be okay. I'm gonna stop sharing. And then hopefully it'll share. Come on, Amanda, last day, really? Can you get it together? Mhm. Heart, no. Da, 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 da. Okay, so while I'm doing this, we'll teach the boys more. So has anyone ever had microblading done on their eyebrows?
No, but I need it.
I just did it for the my first round. It's pretty cool. Pretty cool.
I've never needed it. My eyebrows are like naturally voluptuous.
Oh, well, aren't you just lucky?
Yeah.
Yeah.
Mine are nice. I just want the shape and like not have to like, I just want easy as possible, get up, do nothing, like go. Cause there who has
Did
to,
it hurt?
well, I have a pretty high tolerance for pain because I've got like tattoos a lot. But I'm not gonna lie.
Me too, but it hurts after a while.
I'm not gonna lie. Yeah, it did. I'm not gonna be all tough. It hurts.
Can we see him?
What?
Can we see it?
Can you see what?
The tattoos.
The ones that are in places you are allowed to see, yes.
Okay,
Who asked that question?
me, Christian.
Christian. Well, I can't lift up further, but this side, so it's like a rose. It's hard to show. A clock. This is basically, they're both for my parents who have passed. Hummingbird for my father. All of this is him, his eye. And then this side's all for my mom. She was a nurse, so it's a stethoscope. And then this is the bell. And then my back is all done. Not complete. I'm not done because of freaking COVID. But yeah, it feels good. I think it feels good. Does anyone else? I mean, is it me?
It's therapeutic, at least for me.
Right? It really it's like this, especially if for me, if it means something so deep to your heart, it's just like this feeling of like release. And I don't mean to bring that to self-harm, but that's what self-harm is. And I'm not saying you're self-harming yourself by doing it, but it does give a release. But hopefully you're not self-harming at the same time, if that makes sense. But yes, I agree completely, 100%.
So I have a really low pain tolerance. Like I don't, if you pinch me, I'm gonna cry. Like I hate it. But I have tattoos. But I'm the tattoo, like I love tattoos, but I like them, me personally, where you can't see them. So my tattoos are all hidden. Like you can't see. You could see like part of the one on my shoulder, and my sister picked that one. But the one that hurt the most was my ribs.
Oh,
And
hell yeah. Oh, that was the pain
my Lord
of my life. That in your spine, my spine, that and my wrist. My smallest tattoo, I have a heart. I did CPR on a patient, the only patient that didn't make it when I did CPR. So I did a tattoo for him. And it hurt worse, that and my ribs. Oh my God.
We're not even in-
The ribs are so painful.
Yeah. And the spine.
I want
My
to say,
sister has a huge dragon and she slept through hers on her ribs.
yeah, I
Oh,
almost
no.
fainted too.
Yeah, no, the ribs were the worst for me. Like I have one on my butt and I have one on my shoulder. That didn't hurt. But the one on my
Butt
ribs,
doesn't hurt because that's all fat. Oh, well, I mean, well, it is your butt is
yeah.
fat.
But the rib, I couldn't talk. And me, if I'm in pain, I get irritated and I get silent. So they were I was like, shut up, just leave me alone, walk away. Like, don't try to make conversation. Even the tattoo artist, I was like, don't talk to me right now. Thank you. It was horrible.
Pretty much, yeah. Yeah. So if any of you are gonna get tattoos, make sure you think about it. I waited till I was 32 until I started because I wanted to make damn sure that what I was putting, I meant it. Can you guys see this?
Yes. If you don't
Yeah.
mind, can I ask how old you are?
I'm 37.
Really?
Yeah.
I thought you were like 26, 25,
Well,
26.
Thank you. And I'm, yeah. Well, yeah. Well, it's not going in the sun, wearing sunscreen, taking good care of your skin. Products, honestly, and just happiness, I think. Does a lot. Thank you. I appreciate that. When we go to clinicals, everyone thinks I'm a student, and I'm like, I have this big badge that literally says nurse instructor, because everyone thinks I'm like, I'm the instructor, and then they don't trust. It's this whole thing. It's so stupid. But, and especially the tattoos don't help. So, but thank you. I appreciate
How
that.
do you work around that, like with working? Because you know how some places are adamant about not showing your tattoos.
I'm pretty lucky because I work mainly in addictions, and I'm not saying that, those that are addicted to substances are just, I'm not putting them in a box, but usually, not always, let me tell you, and right now my group is stiff as hell. Like we have a really kind of like stuck up group right now. Like, oh, you do meth, I'm better than you because I drink, kind of thing. It's not the best. I'm like, okay, it's the same thing in the brain. But long story short, I think because mental health, I usually go more towards that. It's a little bit more accepted, especially when I explain my tattoos. Like, these are medallions for people with sobriety. So my mom, she died of an overdose, and this is the last chip she got. My dad had 17 years clean. So there's like a story behind it. So I think that helps too. And I explain it, and I always wear long sleeves to work. So if I know I might see someone that I'm not sure about yet, and I want them to hear my knowledge first, I'll cover them. And then once they get to trust me and I build rapport, then I show them. So I kind of have and then when I go to clinical, of course, I wear that stupid lab coat unless I'm going to my home place, which is San Jose Behavioral Health. And they don't care. Everybody has tattoos there. So they let me wear just like actual just scrubs. So it just depends. It depends. And that was a worry of mine, but I said, once I got into my doctorate program, I don't care anymore. I'm at the highest level now. And like, not saying that if you're not at the highest level, you shouldn't have tattoos, but that was my decision. So now I just own it and love it, and I could care less, and judge me all you want, because I have a lot to be judged on. So as far as big hair, it's just, yeah. So I keep hearing ding dings, and I'm like, are you leaving me? And I can't tell. People are leaving. Are they leaving? You guys can tell I can't. Who's on? How many people?
I think it's something with Zoom today, because even in our theory class, like we kept getting kicked out and everything. It's just something with Zoom.
This is the second time I get kicked out, but I just keep logging back in.
Okay, thank you. Thank you for coming back. Okay, are you guys ready? So we're gonna do the NCLEX questions, because that was a huge one in the what you guys like. And these are actually ATI NCLEX questions. I chose, there's 2 psychiatric ones just for fun, because I think we don't do enough psych, and I try not to, I kind of try to pull away from it, because that's not what this is about, but that's my love. But I do think that it's important. Insulin, because we went over that. The Quizlet questions, which have some insulin stuff in it too, because that's what we did last week. Repeat questions so that we can reiterate. Random just questions in general. And then medication questions, I would say half of which we have gone over, and 2 of them you went over this morning in Miss SB's class. So you guys ready? And it's the same thing. I'm going to call on you. If you don't know it, you say pass. There's going to be like 3 or 4, maybe 5 that I haven't taught. If it has not been taught yet and we pass it twice, that means it hasn't been taught yet, because I'm sorry, I can't remember everything. I will then teach it, okay? So I'm gonna start actually this way this time. And perfect. Okay, so I'm gonna start with Alexis.
Sorry, I'm in a coffee shop.
Okay.
Can I do insulin 100?
You may. All right. So Alexis, true or false? Humalog is a rapid acting insulin. Humalog. And you said true?
Yes, true.
Yep, that is right. Do you remember the little trick I think I taught you guys about the log and the bowel movements? Yay. It works. Excellent. Good job. All right. How about Laura?
Can I do medications for 300?
You may. What is the generic name of Tylenol?
Acetaminophen?
Yes. And I know they seem like duh, but they're really not. They're really, really not. And it's very important to know both. And why? Because NCLEX would say acetaminophen, not Tylenol. So I want to make damn sure that you know the difference. So excellent. Very good. Perfect. All right. And let's do, I think we have two, Ana Lopez, because I think we have two Anas. I can't remember. Sorry.
Okay, can I do medications 100?
You may. So true or false, Tylenol is for inflammation.
I think that's false. It's more like antipyretic.
And what else? What else can Tylenol be?
Pain.
Excellent. So whether you learned it from me, and I don't care if you learned it from me, from SB, from whomever, from yourself, that's exactly right. So I don't know if you guys remember. So I do. And this is why I like to do Jeopardy on the last day, to kind of reiterate the fact that of what you have learned. And I know it's kind of all over the place of what you're learning. It doesn't matter. It all comes together. So if this would have been 13, 14 weeks ago, you may have said true, because there's always that confusion, it seems to be, between NSAIDs, which is like Advil, Motrin, and then acetaminophen, which is Tylenol, and inflammation, right? So you're absolutely right. So Tylenol is for fever and for pain. That's absolutely right. Excellent job. Good. And you guys just, I actually do remember you got it wrong the first time we asked that question. So not specifically, I don't know who answered it, but it was not the correct answer. So good job. You're learning. All right. How about Shanice? Did I say that right?
Yeah. And NCLEX for 500.
All right. Oh, go big. Okay, let's do it. All right. So we have a nurse is replacing a surgical dressing on a client who had an abdominal surgery. Which of the following actions should the nurse take first? I think I maybe should have, I don't know. It was ATI, but basically what should the nurse do? So I have a nurse, she's replacing, he or she is replacing a surgical dressing. And we do know that the actual dressing itself is sterile, but let's read the answer choices. So are we gonna first don, why do we say don? What does that even mean? Why not just put gloves on? I don't get it. Don clean gloves to remove the old dressing. Loosen the dressing by pulling the tape away from the wound. Remove the entire old dressing at once, or open sterile supplies after applying sterile gloves. So,
so you're not going to, it's gonna be B.
Loosen the dressing by pulling it. Okay, so that's what I thought it was when I first was looking at this. That's what I thought first too, because, and it's not wrong, but there's a better answer. And
wait, let me try and figure it out.
Yeah, this is hard because it's all kind of put together, like the way it's worded. So remember, even though it's considered sterile, it's sterile inside, not outside. So am I going to use sterile gloves to take it off? Think about that. Like, think about actually being in the moment. So when you're taking your test, think about being with the patient and what you're actually doing.
Well, we just did our, we just did sterile. We just did that.
Okay.
Yeah. No, we use our regular gloves.
Mm-hmm. So which one would it be?
It would be B. We're going to loosen the dressing, right? Because we're not going to, A, we're not going to,
exactly.
We're not going to, okay. Yeah, that's it. First.
Exactly. So the question didn't say first, I added it. So you're absolutely right. The second thing you would do would be loosening it. The first
Yeah.
thing you would do, you'd put clean gloves on, not do sterile. Sterile is when you're inside, and then non-sterile would be outside. So I'm actually really, really glad that you didn't get that correct the first time, so that everybody can kind of see that, because I guarantee 3/4 of you were probably thinking the exact same thing, which would be this one. But do you guys understand why it's this? Does anyone need clarification? We put just regular old gloves on because we're not touching the wound. We're just removing the dressing. And we can use regular gloves for that. Actually did that last week as a demonstration. Good? Okay, excellent. Good job. All right, who am I going to pick on next? Okay, Shanna, it's you.
I'll take 500 for insulin.
I think did you say insulin?
Yeah, 500 for insulin.
Okay, thank you. Okay, name 3 spots you can give an insulin injection on a body. And you don't have to give the technical terms, just tell me where.
By the belly. The outer skin on your upper arm.
Yep.
And I believe it's the thigh.
Yep. Anywhere that has fat, literally.
Yeah.
Just as long as you got some fat, you could put 45 degrees, 90 degrees, just put it in that fat. But usually the most common is the abdominal area and the back of the arm. But you are more than welcome to use the thigh if patients have some extra cushion, if you will. Excellent. Good job. Okay, how about, why are your names not showing? So when your picture shows or your face shows, it's not showing. Okay, Fernando, what would you like?
NCLEX 400.
Thank you. Okay, a nurse is developing a plan of care for a client. Which of the following pieces of information should the nurse consider when planning care that is culturally congruent? A, illness is not influenced by culture. B, the meaning of a disease can vary widely across cultures. C, assigning clients to a specific culture categories facilitates communication. Or D, predetermined criteria should generate client care activities. So what should we consider, would you say?
B.
Absolutely. Excellent. And that is the answer. Very good. I don't know how to say that name. I don't, I'm gonna do my best. You really? You really? That's right.
Yeah,
right?
that's right.
Okay.
I'll do 400 for insulin.
Thank you.
Like you.
Okay. Explain how you would mix two. Oh, you got the hardest one. Oh, of course. Explain how you would mix 2 units of NPH and 2 units of Humalog. Now, I don't need you to go through the whole check the record, do all that. So you have the 2 vials, you have the alcohol swabs, the insulin injection. Tell me about the air. Tell me about all of that. How would you do it? And can you guys mute if you're somewhere making noise, please? I love you, please.
Would it be the clear insulin first and then the cloudy?
Okay, so let's explain it. So we have our alcohol. So first, what are we going to do with our alcohol?
You clean the vials.
Excellent. And then we have our little orange inject. It's always orange. And we're going to put air into one of them. Which one are we going to put air into first?
Humalog.
So if it's clear before cloudy and we want to suck up the clear first, or short before long, which one would we put air in first? It's always opposite. This is the hardest question ever, and it will take time, and that's why I put it in here.
So then it would be NPH.
Yes. So where else would you go? Where you're all I put it in the Lantis. So so we would do how many units in the MPH?
2.
Exactly. So we'll put 2 units of air into the MPH and then we pull out, right?
Mm-hmm.
And then how many units of air do we put into our Humalog?
Um, 0? Or is it 2?
Exactly. So we're doing 2 and 2. So once we inject that air, we immediately flip up because the Humalog is clear. Remember, clear before cloudy or short before long. So this is shorter. This is intermediate. So I just like clear before cloudy. I'm sticking with it. So clear. So we want to put clear into the injection first, or into the syringe. So how many units are we going to draw up after we put the air? 2. So we draw up 2. And do we have to have another nurse check that? So narcotics, insulin, and what's that thing that's a blood thinner? Help. Heparin. Yes, good job, heparin. So heparin, narcotics, like morphine and things like that, and insulin, we always have a second nurse check. So before I pull it out, so I'm inside my Humalog right now. I have another nurse and say, my order is for 2 units. Do you see 2 units? Do you see 2 units in this syringe? Or he or she says yes or no. Hopefully they say yes. Okay, perfect. And then I pull it out. But now I'm not done, right? Because I still need to actually put my MPH in. And how many units am I going to put?
2.
2. So now I'm going to stick it into the MPH, flip it upside down, and I have to be super careful because I can't squirt back in at this point because I'm in a longer acting insulin. So I'm going to very carefully pull. What's 2 plus 2?
4.
4, exactly. So that's how much I should have in my syringe, correct? So once I get 4, then I go back to the nurse and I say, okay, I put my MPH. You can clearly see it says MPH. Do you agree this is 4? I agree. They're my witness. I pull it out. And it would be how you would do it. And then now let's look at it together. So clean tops of the vials, 2 units of air into the MPH, take out syringe and put 2 units of air in the Humalog, then flip the bottle up, pull in 2 units of insulin, confirm with another nurse, take syringe out, put the syringe back in the MPH because clear, cloudy is MPH, Humalog is clear. MPH is the only one that's cloudy, by the way. And then pull out 2 units of insulin equal to 4 and confirm with another nurse. I just wrote another because it wouldn't let me write. I ran out of room. Does that make sense to everyone? You just have to say it in your head literally 100 times. If you want to take a picture of that real quick, you can. But like, oh, I love it. Hummingbird just came on my outside. I love that. Comes every day and visits. That means something. I don't know if you believe in that, but so any questions about this? This is probably the biggest pain in the ass, but once you get it, you'll never forget it. I promise you. You'll practice and you will get it. I promise. All right, good. And I'm glad we got to go through that together. So we got to go through it together. And that was one of the questions when I said I want to kind of help because I know it's newer for you guys and it's not easy. So thank you for helping me walk through that. I appreciate that. Okay. Okay, Mark, what do you want?
We'll go with NCLEX 200.
Okay. So a nurse is caring for a client who has schizophrenia. Which of the following client statements indicates clang associations? So clang. If I can give you any sort of kind of hint, if you guys have learned, I know you did a little bit of mental health, it's similar to word salad. That's all I'll give you. And I'll just let you read them to yourself and tell me what you think it is. And then if you can explain why you picked your answer, that would be great.
Who was answering this?
Mark,
I don't know much about schizophrenia.
he's deep in thought. But I feel the wheels are turning. So think word salad. So clang is very similar to word salad, and word salad is when somebody, unfortunately, with who has psychosis, which is a detachment from reality, is not able to verbalize what they want. So they'll say things that don't make any sense. So clang is similar, but it has a little bit of a different component. And what the hint I'll give you will be, it tends to kind of, I don't want to say rhyme, but I'm going to say that and see if you can get
it. D.
Okay. So exactly. Okay. So number one, we know it's not that, because it has nothing to do with anything, because that makes complete sense. I'm feeling whatever the heck that says, that that doesn't even make sense. Clang makes sense to a certain degree. It just means you're rhyming. And then the next one is option, contrary, moose, allergic. That's word salad. So letter C is word salad. So this is actually perfect. Good job. So this is perfect. So C is word salad. I'm just saying words just to say them. I don't know what I'm saying. And it's very, I can only imagine what that must feel like as the patient. And then D has more to do with rhyming. It's like almost like, I kind of think of it as clang, slang, like rapping, if you will. So basketball in the hall, very tall. Does that make sense? So think of clang as slang. Does that kind of help? It's very, to be honest with you, it's pretty rare. It's not something when I saw this question, the only reason I picked it is because I've never actually dealt with a patient, and I work in mental health for 13 years. I've never had a patient use clang before. I've only seen word salad, but I figured, hey, that'd be kind of cool. Why not give it to you, right? So does anyone have any questions about that? Word salad is letter C, clang is letter D. More rhyme, rhythm.
Those schizophrenic patients, they use word salads as well, or?
Yes. So they can they'll use word salad, which is just a bunch of words that make no sense that go together. And then clang, again, usually doesn't necessarily mean anything like, hey, I'm hungry, can you give me food? But it has to do with like rhyming and getting excited that, and I'm not trying to be demeaning, that to their brain kind of makes sense because it rhymes and it sounds the same. And it's, unless you see it, and that's what sucks because you guys don't have mental health, it's hard to really understand it. But who knows, you may get a question like this. So remember, word salad doesn't make sense. The words don't have anything to do with each other. Clang is rhyming. So if you can remember those two things, that would be important for your NCLEX. And I don't know, that's excellent. Very good. Probably did this one on ATI, didn't you? So how you got it right?
No, I just picked the one that was rhyme. You said rhyme, that's why.
Oh, I did. Okay, yeah. Okay, I guess I gave you the answer. Okay. Well, apparently someone's not a liar. Okay. All right, Kat, you're up. Good job, by the way. How do I get out? Okay, Kat.
Random 100.
Thank you. I forget what I even put over here. Is Advil considered a controlled substance?
No.
You're absolutely correct. So a controlled substance, which I think I spelled that wrong. I think there should be another L. A controlled substance is something that has the potential to be addictive. So that would be something like Vicodin, OxyContin, heroin, methamphetamines, amphetamines, things like that. So Advil is not. And anything sold over the counter in the United States, just as a fun tip, anything, again, United States, anything sold over the counter is never going to be considered a controlled substance. You must have a prescription in the United States to be prescribed, unless you're obviously buying it off the street. Very good. How about Erica? I know you're driving. Are you okay? Are you safe? I can pick one for you.
Okay, we're good. Let's see. I will do, let's do an NCLEX question for 300.
Okay, I like it. Okay, so a nurse on a medical surgical unit is caring for a client. Which of the following actions should the nurse perform first when using the nursing process? So again, let's think about the nursing process. What is the first thing in nursing process that we do? By the way, just for a fun fact, this was the only one I got wrong when I did these because I did the ATI because I went too fast. So always take our time.
We checked their band.
We'll definitely check their band. So A, what's the first thing you're going to do in the nursing process? You're identify goals for client care. B, obtain client information. C, document nursing care needs. Or D, evaluate the effectiveness of the care. What's the first thing you're going to do? I have a feeling you're going to. Yeah, that's what I picked. No.
No.
So you picked B, and I'm going to tell you why. Because we can't obtain client. Wait, oh no, you're right. I'm sorry. You're right. I'm wrong. I picked A at first, just like, oh, identify the goals, of course. Well, how can you identify the goals if you don't obtain the client information, right? Because you need to know what are they capable of doing, what do they need. So excellent. Good job. I got it wrong. You got it right. See? We make mistakes too. We're human. Good job. All right. How about Veronica?
I'll pick the other NCLEX question.
Okay. Which one?
The last one.
A nurse is discussing family therapy with a client. Which of the following statements by the nurse is therapeutic? So therapeutic, you will definitely have this on your NCLEX. Remember, therapeutic tends to be an open-ended question. Not every single question can be open-ended. That would be like, I mean, sometimes we just need to know yes or no. Are you having pain? Yes or no. But therapeutic, think open-ended, nice, very, calm. So what is therapeutic? Family therapy help my family. I need to sign up for family therapy. Family therapy can bring about change. Why do you think you need family therapy? And let me go back because I talked too much and didn't probably give you, oh no, I'm scared. What if I go back and it takes us all the way back? What was the question, you guys?
The therapeutic
Something
response.
about which one is therapeutic. Yeah.
Okay, so if I'm talking to a patient, what is going to be the most therapeutic thing that I could say out of these about having therapy, right? I think. Yeah.
So is that asking what would I say back?
Yes. It would be what would you say to me if I was your patient and perhaps you felt therapy would be therapeutic for me? What do you think would be a therapeutic sentence to say to me in order to help me get into therapy?
I would probably ask you, D, why do you think you need family therapy?
And that is actually probably that's on ATI is a very common answer. And this is why we specifically picked this one actually, is because most people pick this one. And I'm glad you picked it because, and again, I know it seems weird when I say I'm glad you picked the wrong one because that helps everybody else because again, let's get it wrong here. And a lot of people probably agreed with you, but let's look at these together. So we're going to figure this out together, Veronica. I'm with Veronica, right? Yes.
Yeah.
Okay. So if I picked A, family therapy, help my family, that's not therapeutic because I'm talking about myself. This is not about me, it's about them. So we know we're going to eliminate that immediately. Letter B, I need to sign you up for family therapy. That's not therapeutic because I'm not listening or even giving that patient the time of day, right? It's kind of okay, I don't want to do family therapy. I'm not even including them in the care. And don't we always include people in the care? So we definitely wouldn't want to do that. And then letter C, family therapy can bring about change. Doesn't that sound pretty?
Yeah.
Doesn't that
Yes.
sound like something that's shows the patient that and hopefully the person does care, that I care about them, and family therapy can bring about change. And I'm not saying it will, I'm saying it can, because the person has to do the work. So do you guys, ow, oh, sorry, my ankle's killing me. Letter C, would you guys agree that that is the most therapeutic after re-looking at it? Family therapy can bring about change, and then having that the other person would come back with whatever they have to say, like F you, therapy's stupid, and then you could hopefully have something therapeutic to say back, or look at them with a blank stare, depending on how skilled you are. Do we agree, or does anybody disagree? Veronica, do you agree?
Yeah, I agree.
Do you like this? Do you feel this is more therapeutic than letter D?
Well, if it's like telling them why do they need it, yes.
Exactly. So are you agreeing with me?
Yes.
Okay. I'm like, help me, please. Please help me. Okay, perfect. So family therapy can bring about change. So that's the most therapeutic thing that I can potentially say to my patient.
Mhm.
Excellent. Teamwork. Okay, Guadalupe.
Let's do random questions 200.
Thank you. Okay, true or false? Neurotransmitters come from neurons while hormones come from glands.
True.
Absolutely correct. An example would be dopamine is a neurotransmitter that comes from the brain in the neuron, and a thyroid hormone, or actually I like adrenal glands, it's like my favorite. They pump out the stress hormones. Okay, excellent job. Do you guys mind if I do a couple, because I do have a class at 2:30 and it's my fault that we went over. Can I bang?
Yeah,
do
them all.
Here, I'll do them all. Okay, what is the average gauge of an insulin needle? Everybody. 20.
5.
Isn't it like 20, 27?
7,
What is this?
28.
29.
24?
What can you read?
29.
Who has kids?
29.
29. Yes, Guadalupe. 29. 29 gauge is the average gauge, because remember, the bigger number you go, the smaller it is. You want a very small needle for that insulin, because you're going to get into that fat and you don't want pain for that patient. Name 2 antidepressants. Everyone, just blurt it out.
Lexapro.
Lexapro. Yep.
Paxil.
Yep. Zoloft. Yep. Wellbutrin. Excellent. See how smart you guys are? These are a lot of repeat questions too. True or false? Neurotransmitters have several different jobs depending on where they are working in the body. Is that true or false? True. That is absolutely true. 100%. Depending on where they are on the body is how they're going to work. Very good job. How far from the umbilicus must you go when you're giving an insulin injection, and why?
2
inches.
Yes, 2 inches. And now one question that maybe, and what drives me crazy is, we need to know why. Not just 2 inches, but why? Why is that? Were you guys taught that? No.
Was it because the umbilicus has a lot of nerve endings, I believe?
That's exactly right. Yes, that's exactly right. Very good. Vessels. We want to stay away from those vessels, because remember, insulin goes into the fat. If it goes into the blood, it does nothing. And then you're just, number one, you're going to hurt the hell out of the patient. And number 2, you're not giving the patient the adequate amount of insulin. Very good. You guys are like, do you see your improvement? I mean, hopefully you're some sort of like gratification. Yeah, this is great. Okay, true or false? 90% of your serotonin is in your gut. I don't know if I taught you this yet. Does anyone know? It's kind of interesting.
I'm gonna say no.
And everybody would. But it's actually yes.
Yes.
It's yes.
Wow.
Yeah.
It is, and which is so odd, right? Because you would think, oh my God, serotonin's in your brain. Remember earlier we said that neurotransmitters do several things. So I'm going to keep it short, sweet, and simple so that it's concise and rememberable. So serotonin plays a very important role, and it's called feeling satiated. So for example, when you're eating, of course, there's the stretch hormones in your stomach and whatnot, but when you're eating your food, your serotonin in your gut will actually help you feel satiated and say, okay, Amanda, stop eating that fake chicken patty. And I'm like, no, I want more. I want more. And then we just keep eating usually. But that's why they say eat slow, right? Because we want our body to, I think I spelled percent wrong too. I can't spell. But so remember, 90% of your serotonin is actually in your gut, and it has a purpose to feel satiated when you are eating. 10% is only in your brain. And this is the key to the case. That is why when you start anything that has to do with serotonin, an SSRI or an SNRI or anything that has to do with serotonin, an antidepressant that has to do with serotonin, most people get stomach upset. Wouldn't that make sense? Because it's systemic. It's all over your body. You're putting this pill in your mouth, right? You're putting it in your mouth, and it's going to not just ignite what's in your brain, it's also going to ignite what's in your gut. So a lot of times diarrhea, constipation, nausea, and usually your body will become homeostasis and say, okay, I can deal with this and I'm going to let it go. Or you might have like a little bit of symptoms and it outweighs the good and the bad, right? I'd rather have a little bit of constipation and not be depressed. So we have to outweigh the two. Isn't that cool? I don't know. I think it's fascinating. But I'm also a psych nurse and a nerd. So, okay, random questions. What is glucagon? Why are we going to give it? Hyper or hypo?
Hypo.
Hypo, exactly. We mess up or something happens, glucagon, get that in there and it will save your patient's life. Very good. True or false? If a medication does not ignite, you know what, we're going to skip this. It's too complicated and it's going to lead to like I won't be able to stop. Sorry. My self-control is, I'm very impulsive. Okay. Ooh, I like this one. This is important. Hallucinations. So we have 5 major hallucinations that somebody can have. And by the way, it's not just those with schizophrenia, people who have bipolar disorder, people who are having just psychosis in general. Myself, today I had I feel like I had a hallucination. When I was driving, I was so tired and hungry. I swear to God, like I saw like a giraffe on the road. Obviously there wasn't a giraffe, and I sound like now I have psychosis and I don't, but I was so out of it. Don't you guys feel like that half the time? Because you're so tired. You're like, what is that? And like you like move and it's like your hair or like nothing.
Yeah.
So we're all because we need more food, we need more sleep, hydration, all that. But if there are actual hallucinations, there are 5 of them. And this is how I always do it. I start by touching my face because this is how you'll remember. So there's visual. And you can use the real words or not. You guys haven't gotten to psych, so I'll give you both. Hearing, which is also called auditory. Smelling, which is also called olfactory. Taste, you can actually have a hallucination. You guys know what a hallucination is. It's not really there, right? Like Obama's not sitting on my chair next to me. I'm not hearing voices or if I'm
this weekend, I worked with a patient who like woke up out of nowhere and she's like, did I eat my tacos? Because I swear I dreamed that I ate my tacos and they're still there. And I'm like, no, I mean, they're still there. So
and they can, and that's gustatory actually. Taste, people can feel like they actually it's usually not yummy stuff like tacos. It's usually like feces or like dog shit. I mean, I don't mean to be like rude, but I've had a lot of patients will tell me like, why did you give me shit for dinner? You gave me shit. I taste feces. And I'm using cursing because that's what they're saying to me. So it can absolutely happen. I mean, you can taste it, or stuff that in your, how do you know what poop tastes like? I hope you're not eating it. But so visual, auditory, olfactory, taste, or it's actually called gustatory. But if you say taste, I'm happy with that. And then there's one more, it's called tactile. And that's when you feel like something's on you. Something's like on your skin or touching you that's not there. So like if Erica's like, what the fuck, what? And nothing's touching her, that would be a hallucination. Any questions about that? I won't go deeper than that. I just want to say very surface.
No, thank you. That was informative.
Good. Thank you. It's my favorite thing in the whole world. Not to have them, but to be a part of them. Okay. Medications. We've talked about gabapentin a lot. Gabapentin can be used off label. It was originally made for seizures, but we use it off label a lot for sleep, neuropathy, and for anxiety. So when you go to your patient's chart and you see it's for anxiety, you'll know why. It's being used off label for a purpose that it was not intended for, which is on here as well. How old do you need to be to buy Sudafed and why? How old do you need to be?
18.
And do you have to sign a binder?
They take your ID.
They take your ID and you're supposed to sign something. And why is that? What does Sudafed help make?
Crack.
Close.
Meth. Meth.
It's okay that you don't know that, Cat. It's okay. Meth. Exactly. It's hello, what's that show called? Breaking Bad. Best show ever. Yes, methamphetamine. So now we have these whole new rules and laws where we have to be careful, and they keep track of how many people are buying Sudafed because meth is being made from it. Okay. Insulin. Can I mix insulin with NPH? If you guys get this wrong, I'm just leaving right now.
No.
Okay, thank you. Good job. And how long does Lantus last in the body? Lantus, L for long.
24.
4 hours.
Yes. Do you seriously? Who are you people? Third semester? Excellent. What is, this is different. This is one I did not teach you. So what is a cures report for controlled substances? Does anyone know what a cures report is?
Yeah, this is a report that the doctor runs to see if the patient is getting prescriptions somewhere else. It actually shows like actually the doctor's like name and
yes.
Yeah.
Do you mind if I asked, do you work at like a clinic or somewhere where you've been?
Yeah, I actually worked at a doctor's office, and it's so funny because our favorite patient, 78-year-old woman, would go for her Vicodin. And that day, the doctor that would always give her Vicodin couldn't see her, and the PA was like, all right, well, I'll see her. So then the PA looked up the record, and we seen that she was getting morphine from like another doctor within the area. And like, she was so embarrassed, and we just couldn't believe it because she thought she was like our favorite sweet patient, Never did we suspect that that she was getting meds somewhere else, and hardcore meds.
I was gonna say morphine is a pure opiate. That's pretty hardcore. That and codeine are pretty hardcore meds. And this is Guadalupe, right?
Yeah,
you're absolutely right. So and a cures report is very helpful. So you have to have a special ID to get in. And you're absolutely able to see what other physicians or NPs or PAs or whomever are prescribing medications. Therefore, you can be safer when you're administering medications, because a lot of patients do doctor shop. And unfortunately, and I won't get in, I'm only going to say like one line, otherwise I will not stop talking about addiction because I love it, or teaching about it. But like for this poor older woman, she had a physical dependency, which changed her brain chemistry. And I'm assuming because she'd been probably taking these for years and years and years, And if we don't have this cure, now that we have the cures report, we're able to usually put a stop to it quicker, because then family members start to find out, and then hopefully we can get addiction under control and save lives. That's the hope. So that's what a cures report is. And I think that's kind of cool to know that we can check that. And just a fun fact, when I worked at a methadone clinic in Santa Cruz, Janus of Santa Cruz, we had our patients, oh my God, they're so smart. They would actually take their dog's medication. We would look it up, and they would take their dog's tramadol, which is an opiate. It says it's not an opiate. It's an opiate. It's an opiate. And they would take their dog's medication to get high. And I'm sorry, but that desperation, if addiction's not like, in my opinion, those that think addiction is not real, for that desperation to get that hit, I mean, it takes over Maslow's hierarchy of needs. Oh God, I should teach an addiction class. That's what I should do. That's what should happen, I think. Okay, yeah, I'm gonna, but that's mental health too. Okay, sorry. All right, let's go. My 2:30 class is gonna be like, Ms. Amanda, hurry up, they're brats. Okay, what does the term off label mean? We already went over it. Medication that is used for another purpose that it was not intended for, like gabapentin. Benadryl is an antihistamine, right? But what can we use it for? We can use it for sleep,
allergies,
Sleep medicine.
exactly. And what is the other name for diphenhydramine? You went over this morning. Oh, shit.
Benadryl.
Sorry. Yes.
Benadryl.
As I give you the answer. What does SSRI stand for? It's an anti-anxiety or anti-depressant. Selective serotonin.
Selective serotonin reuptake inhibitor.
Exactly. And which neuron does it work on? You just said it.
Serotonin.
You got it. Excellent. Good job. And now, what is Benadryl made for? We just went over that. And then the last question. I don't know if I want to do the last question.
Do it.
Okay. What does SNRI stand for? I will fall over if someone knows this.
It's the is it like norepinephrine reuptake inhibitor?
It is. So it is. So very good. So it's we double use the S. So it's selective serotonin norepinephrine reuptake inhibitor. So like Erica said, for SSRI, it works on serotonin as well as norepinephrine. So different. Your baby likes that. Is excited about that. No, it's fine. So it works on more than one receptor in the brain, depending on what the prescriber feels is going to be best for depression. I would go way more into it, but that's not what we're here for. I just want you to be able to recognize it. So if you see it in a chart, you may not know exactly what it is, but you'll remember that has to do with depression. And just having that recall can be really, really cool. So so we win. You're all gonna pass. I'm not gonna lie, for a minute I was gonna be mean and be like, if you're missing more than 5 assignments, you're not gonna pass, but no one's missing more than 5 assignments. But I was gonna like scare you, but no one, I think the top is like 3 assignments. So thank you so much for turning things in, being present, showing up, participating, just being here. I really hope this is not, I don't think this will be the last time that we'll have interaction. I am gonna contact Dr. Kazmar. And I had no idea what to expect when I started teaching this class. And I just kind of made it up with you guys. And I personally feel very satisfied with what we've done. And I've seen I wouldn't say it if I didn't mean it. I just wouldn't say it. I've seen a lot of growth, a lot. People stepping up and just like taking a chance, even if they're wrong, and it's okay to be wrong. And just your knowledge base is really impressive. You may not feel that way in other areas, but I see it. So I hope that you see it. And I wouldn't say it if I didn't mean it, I just wouldn't say anything. So, and Madison agrees, apparently, my dog. So, if you need me, seriously, during my speech, quiet.
I have a Chihuahua.
I have 2 Chihuahuas, a Boston, and a pug, and it's the I'm gonna